As a family, we knew that we needed help, and so we called 911, and it was the fire department that came out. However, with them, they brought a social worker.
My name is Brianna Jones, and I'm a licensed master social worker and the coordinator for the EMS prevention program. The EMS prevention program is a division within Tuscaloosa Fire Rescue that aims to improve community health and reduce overuse of the 911 system.
What we noticed in the fire service was there was an unmet need, and that unmet need is follow-up services after the call. 911 handles people's emergencies in that moment, but these people had long ongoing needs that needed to be addressed afterwards, or they would just continue to use 911. So EMS prevention was born out of a need to prevent 911 or to address those issues before they become chronic 911 problems.
When people call 911, that may be one of the most desperate acts of needing help there is. And if you have someone who's mentally, in mental distress, or they've reached the end of their rope and they don't know where to turn, 911 is very symbolic of where he or she may be in their life. For that person, it may not be a heart attack or someone breaking in their house, but it probably is at the same time as dramatic and desperate as it gets.
The EMS prevention program was very helpful to our family because I ended up having a psychotic break, and the fire department came to help with that. And while I was having crisis, the EMS prevention program comforted my mother and assured her I would be taken care of and I would be transported to a hospital. And then they followed up for a very long time after that and were able to help plug in resources.
And I think that's what was the most important thing, was that there was follow-up. She was there to tell me all about services that I may qualify for, to get me in touch with the right people. These were things I was totally unaware of.
There's no secret that coming to the emergency department for a social issue doesn't do anything but temporize the condition. It doesn't take care of the bottom line of what was that patient calling for. Sometimes they're coming just because they're scared. They don't know what to do. So I think those are issues that we can help with EMS prevention.
The EMS prevention program has really cut down on the repeat calls to the same addresses. We make lower number of calls to those patients, and when we go to those patients, they are they have a better quality of life than they did before.
One thing I want to thank you for helping me the way you did. It really helped me out a lot, even just nightgowns, clothing, food, bills, whatever I needed. And it was a good thing.
When I get the referrals from the firefighters and I make that initial contact with the people in our community, they a lot of times just think that their only option is to call 911. There's a big lack of knowledge of what all resources are available for them. And so when we get in there and we do these assessments, that really helps them to see what other services they're available for, and helps them to not need 911 for these calls, but in that case we refer them to someone else so they have a different option other than to just call it 911.
Not only is this a morally sound policy, it's fiscally sound policy, and they both come together. And I'm really proud of the men and women of Tuscaloosa Fire and Rescue for leading this type of program. And I also see this unique marriage that's beginning to take place between fire and rescue and social work. I think there is definitely a place for us to build on and layer on top of professionals in this field to help us every single day and to help our men and women who are out there being our first responders.
Personally, I'm a big fan of the EMS prevention program.
I think it has made the firefighters very happy because they are not constantly going to the same person, and it's not taking them out of service to respond on true emergency calls.
Yeah, I've been real happy with EMS prevention services, and they really helped me. And I don't know what I would have done without them.
As far as the patients go, I think that, they may be a little bit hesitant at first, but once we get in there and we really build a good relationship with the people in our community and they see how we can help them and give them a better, healthier lifestyle, our patients are very happy as well. They're very committed to meeting their goals and to working with us to reduce their need for 911.